The fluorescent lights hummed their endless mechanical song above the pediatric wing of Seattle General, a sound like a tank idling in a distant garage. Katie Rodriguez moved through the hallway at 2 in the morning with the quiet precision of someone who had already survived worse than insomnia, worse than the smell of antiseptic that never quite masked the copper undertone of human fragility. 8 months. She had been at Seattle General for 8 months, working night shifts in the pediatric ward, and in those 8 months she had become invisible in the way only people are invisible when they are very good at what they do. The linoleum floor was still damp from the evening cleaning crew. Her white rubber-soled shoes made no sound. She passed the nurse's station where 2 residents slouched over their charts, both too tired to notice her approach. The older one, a man in his 30s who would never survive a real crisis, didn't glance up as she adjusted the 4 line on room 412, a 7-year-old girl with leukemia who would respond to her chemotherapy protocol within 6 weeks. Katie knew this the way she knew things now, the way her hands knew things, the way her eyes read vital signs and patient charts with the pattern recognition of someone who had once stood in a field hospital outside Ramadi while mortars fell like rain and sorted the living from the dying in 60 seconds or less. Her locker was in the break room on the 4th floor, wedged between a vending machine that accepted crumpled bills and a bulletin board announcing a bake sale nobody would attend. She opened it at 3:44 a.m. during her meal break that she did not take, that she spent instead reviewing patient files and hand-washing equipment that the hospital's sterilization team had already cleaned twice. Her scrubs hung pressed against the metal frame. Her ID badge clipped to the stethoscope she wore around her neck like a talisman. And in the lower left corner, nestled behind a single change of clothes that she kept for emergencies, was a small wooden frame containing a flag folded into the crisp triangle that only military funeral detail could achieve. The flag was old. Not ancient, but worn in the way things are worn when someone has held them too many times, run their fingers across the weave too many nights, pressed it against their chest during the dark hours before dawn when nobody is watching and there is no protocol for grief. The colors were still vibrant enough, red, white, and blue, the design still precise at the edges where the military had folded it with mechanical perfection. But the fabric itself had softened from handling, the same way a combat blade loses its shine from use but never loses its edge. When Sarah Chen, one of the other night shift nurses, had asked about it 3 months ago while they were both staring into the break room refrigerator, Katie had told her it belonged to a cousin. Killed overseas. Sarah had nodded with the distant sympathy of someone who had never actually known a dead soldier, had never held their folded flag at the funeral, had never kept it in her locker as a reminder that there were worse things than difficult patients and demanding doctors. Katie had not volunteered additional details. Katie had learned long ago that the less you said, the less people could use against you later. The less you said, the longer you could hide. She closed the locker and returned to the pediatric wing. Room 407 needed vitals. The monitor on room 412 showed the girl was sleeping now, her small chest rising and falling in the rhythm of medicated rest. Katie checked the 4 catheter, a 20-gauge line that had been placed by a resident who had used a technique Katie could have corrected but didn't. You didn't correct people unless it mattered. The girl's blood pressure was 98/64. Heart rate 78. Oxygen saturation 99% on room air. All normal. All exactly as they should be. Dr. Robert Pierce arrived for morning rounds at 6:15 a.m., though nobody expected him that early. He was tall in the way men are tall when they have always been given things without earning them, when they have moved through systems that rewarded confidence over competence, when they had never once been told no and had therefore never learned what no actually meant. His white coat was pressed. His tie was silk. His hair had been styled by someone who charged $200 for the privilege. He carried a tablet and an expression of mild perpetual irritation, the look of someone accustomed to the world failing to meet his standards. Katie was adjusting the central line on room 423 when he walked past. She did not look up. The patient in for 23 was a 12-year-old boy recovering from an appendectomy, 3 days post-op, and his line was beginning to show signs of localized edema around the catheter insertion site. Katie noted the slight swelling, the temperature of the surrounding tissue, the subtle heat that suggested early infection. The boy's chart indicated he was on prophylactic antibiotics, which meant either the antibiotic regimen would be sufficient or they would need to escalate the line to a more central location, possibly a PICC line through the antecubital fossa. She made a note on the chart in her precise handwriting, observe for signs of line infection. Consider PICC placement if edema persists. Pierce stopped walking. Katie felt his attention settle on her like weight. Rodriguez. He said her last name only, as though her first name was something beneath his notice. That notation. Is that your assessment, or are you reading the attending's notes? Katie finished securing the line with a clean dressing, smoothed the tape with her fingertips, and turned to face him. Her eyes were grey-blue, the color of the Atlantic in winter, and when she met his gaze she did not blink. The edema is new. I documented what I observed. You're a nurse. Not a diagnostician. The boy has a fever. She had not taken her eyes from his. Low grade. 38.2 Celsius at 4 a.m. I noted it. The central line is the most probable source. Pierce's jaw tightened. He was not accustomed to being corrected, particularly not by someone who emptied bedpans and checked monitors and wore scrubs that had cost $43 at a supply store. He looked at the chart. Look back at her. Then moved down the hallway without responding, his shoes clicking against the linoleum in a rhythm that sounded like anger. That was the moment Katie understood that she had made an enemy. Not through any fault of her own, not through any action other than being right and saying so, which had always been dangerous for people like her, people who existed in spaces where they weren't supposed to exist, people who carried skills they weren't supposed to carry, people who corrected doctors when those doctors were wrong. She had learned this lesson in Ramadi. She had learned it in a field hospital outside forward operating base Shank when she had told a colonel that his patient needed a needle decompression for a tension pneumothorax, and the colonel had argued with her until the patient's oxygen saturation dropped to 72, and then she had performed the procedure anyway, 16-gauge needle through the second intercostal space at the mid-clavicular line, the hiss of air escaping like a final breath, and the colonel had never quite forgiven her for being right. Pierce would not forgive her either. By 7 a.m., when day shift nurses began arriving and the morning light turned the hallway into something more resembling a normal hospital and less like a purgatory lit by flickering fluorescents, Katie had already documented 12 charts, flagged 3 potential complications, and gone invisible again. The boy in 423 was sleeping. The girl in 412 was beginning to stir, the chemotherapy drugs working their calculated destruction through her bloodstream with the precision of a missile strike. The morning was routine. The morning was normal. But in his office on the 7th floor, Dr. Pierce was opening a file on his hospital-issued tablet. Katie Rodriguez. 8 months employed. Night shift pediatrics. No prior employment history in the system before her hire date of January 2024. No college degree recorded in the usual databases. No nursing board certification listed under the standard registry. And yet somehow she had been hired by Seattle General, one of the most prestigious teaching hospitals in the Pacific Northwest. That alone was worth investigating. That alone suggested something was wrong. He would find nothing, of course. Not in the usual places. Not in the systems that people like him knew how to access. But that wouldn't matter. He had decided that Katie Rodriguez was the kind of problem that could be solved by making her life uncomfortable enough that she would leave. He had done it before. A resident who had questioned his diagnosis. A nurse who had filed a complaint about his bedside manner. A surgical fellow who had just suggested, that his technique might be improved. All of them had left. All of them had found positions elsewhere. And all of them had learned the specific terror of making Dr. Robert Pierce look foolish in front of his peers. What he didn't know was that Katie Rodriguez had already been destroyed once, and the Pentagon had given her a new name to prove it. What he didn't know was that she had held people together through hemorrhagic shock and sepsis and wounds that would have been unsurvivable without her intervention. What he didn't know was the flag in her locker and what that flag represented, and what it would cost her to watch someone suffer because she had chosen silence over honesty. But that wasn't the worst part. The worst part was coming. Thursday morning arrived with the weight of accumulated silence. Katie moved through her shift at Seattle General with the mechanical precision of someone who'd learned to make herself smaller, less visible, less threatening to men like Dr. Pierce. She'd been there 8 months now, long enough to know the rhythms of the hospital, the corridors where she could move unseen, the supply closets where no one asked questions. The folded flag in her locker remained undisturbed, a small memorial to a life that no longer existed, carefully explained away as belonging to a cousin. No one pressed for details. People rarely did with Katie. The intercom crackled at 10:15, all residents report to conference room A for grand rounds. The announcement carried the weight of ritual, the kind that happened every Thursday morning without fail. Katie finished her charting and moved toward her next patient when she noticed the stream of white coats flowing toward the conference room like water finding its course. 20 residents, maybe more. She kept her distance, aware in that particular way trained soldiers are aware, the constant low-level scan for threat, for exits, for positioning. Dr. Pierce stood at the podium like he owned the room, which, in a manner of speaking, he did. His voice carried the particular arrogance of someone who'd never faced real consequences, never stood in a position where a single mistake meant blood on your hands. He was tall, silver-haired, the kind of physician who'd built his reputation on the backs of nurses and residents who cleaned up after his oversights. The pharmacy error 3 weeks ago, the one Katie had caught and corrected before it reached a patient, still burned in his chest like an unhealed wound to his ego. "Before we begin," Pierce said, his gaze sweeping the room with the precision of a hunter spotting prey, "I want to address something." A teaching moment. His eyes found Katie through the glass window at the back of the conference room. "Miss Rodriguez, would you please step inside?" The room temperature dropped 3 degrees. Katie moved with measured steps, the kind that came from years of entering hostile spaces where panic was a luxury you couldn't afford. 30 pairs of eyes tracked her progress to the front of the room. The residents shifted, uncomfortable with the electricity of what was about to happen. They could sense it, the predatory pleasure in Pierce's voice, the setup of someone about to use another person as a cautionary tale. "Everyone," Pierce began, gesturing at Katie with the casual dismissal of someone pointing out a stain on the floor, "this is an example of what happens when nursing staff confuse confidence with competence. When they believe their job is to question physician decisions rather than execute them." Katie stood motionless, her hands loose at her sides. Her face remained blank, not the blank of fear, but the blank of someone who'd learned to remove herself from moments like this, to let the words wash over without penetrating. The technique was familiar. She'd used it in briefing rooms before operations in Ramadi when senior officers made decisions that would cost lives. 3 weeks ago, Pierce continued, warming to his performance like an actor finding his rhythm, "Miss Rodriguez believed she'd identified a medication error in one of my prescriptions. Brought it to the pharmacy. Made quite a fuss, actually. Had the audacity to suggest I'd made a mistake." He looked at her with a smile that never reached his eyes. "Except I hadn't. The error was in her reading comprehension. Not the first time, either. Her charting from last week, we've identified at least 4 separate incidents where she documented information inaccurately. Charting above her station. Making assumptions a floor nurse simply isn't qualified to make. 11 minutes. Katie would later count them. 11 minutes of standing in the center of that room while Pierce detailed fabrications, manufactured discrepancies, decisions he claimed she'd overstepped on. Charting mistakes she'd never made. A medication dosage she'd never questioned. All of it delivered with the confidence of someone who understood that repetition sounded like truth if you said it loud enough in front of enough people. The residents stared at their tablets. 2 attendings she'd actually had conversations with, Dr. Morrison and Dr. Hayes, suddenly became very interested in the pattern of the carpet. Their discomfort was palpable. They knew better. They'd worked alongside Katie. But there was a hierarchy in medicine, as rigid and unforgiving as any military structure, and speaking up meant challenging someone with institutional power. "This is what happens," Pierce concluded, his voice dropping to the tone of a disappointed professor, "when people watch too much television and develop ideas above their actual qualifications. This is why we have scope of practice regulations, Miss Rodriguez. I suggest you remember yours. The dismissal was casual. You can go. Katie turned and walked out. The fluorescent lights hummed their mechanical song as she moved down the corridor. Her pulse remained steady. Her breathing remained controlled. These were things she could control. What she couldn't control was the way Dr. Morrison suddenly needed to check on a patient in the opposite direction when she passed, or the way Dr. Hayes found urgent business at the far end of the hallway. 2 hours later, at the vending machine near the break room, Katie was selecting black coffee when Dr. Pierce arrived with 2 other physicians she recognized, Dr. Simmons and Dr. Whitmore, both attendings, both men who'd smiled at her during shift changes before they learned which way the wind was blowing. The vending machine hummed its mechanical rhythm. Katie fed in her dollar bills with deliberate slowness. Pierce's voice arrived before he did, loud enough to carry but crafted to sound casual, conversational. Rodriguez, I've been thinking about your future here at Seattle General. I want to help you find a better fit. He moved beside her, positioning himself between Katie and the exit with the territorial precision of a predator. You're clearly a competent enough nurse at a certain level. But this environment, trauma rotations, critical cases, the level of independent judgment we require, it might be above your actual capabilities. The smile on his face was the smile of someone holding all the cards. He had administrative power. He had the ear of department heads. He had colleagues who owed him favors. He had momentum. I think you'd be much happier at a less demanding facility, he continued, his voice smooth as oil. Community clinic work. Something more your speed. We could help facilitate a transfer, actually. No hard feelings. Just a better match for your skill set. Dr. Simmons smirked. Dr. Whitmore looked away. Katie finished inserting her money. The machine whirred. Her coffee fell into the dispenser with a soft metallic sound. She reached down, retrieved it slowly, and turned to face him with a kind of stillness that made the air around her feel different, denser somehow, like the moment before a lightning strike when the ozone changes everything. Your ex-wife called yesterday, Katie said quietly. Asking if we validate parking for attorneys. I told her we don't validate anything cheap. She walked past him to the break room. Behind her, Dr. Pierce's face flashed the color of arterial blood. Neither Dr. Simmons nor Dr. Whitmore made eye contact with him for the rest of the day. By the next morning, Katie's patient assignments had been cut in half. All critical cases reassigned. Her schedule, which had previously rotated between day and night shifts with occasional trauma coverage, had been altered to days only. No trauma rotations. No critical cases. Just routine floor work, exactly the kind of work that would make her invisible enough to ignore. At the nurses' station around noon, 2 colleagues who usually ate lunch with Katie suddenly remembered other obligations. One whispered to another in the kind of stage whisper meant to be heard, Pierce says she's been falsifying charts. That's why he called her out in grand rounds. Apparently it's been happening for months. The poison spread through the department like an infection through tissue. By afternoon, 2 more nurses had adopted the same careful distance. A resident who'd asked Katie questions about patient care 3 days ago now had her eyes forward whenever their paths crossed. The machinery of institutional power had engaged, and Katie understood with perfect clarity that this was the opening move in a longer campaign. But that wasn't what kept her awake that night. That wasn't what made her sit alone in her apartment, staring at nothing, the folded flag from her locker pressed against her palms. What kept her awake was something she'd seen that same afternoon, a small girl in the pediatric ward, crying in pain while her mother held her hand, while a nurse tried to comfort her, while 5 separate doctors moved through her care with the casual confidence of people who'd never had to count the cost of being wrong. The girl's name was Emma Carver. Her father was deployed. And something about the way she held her swollen leg, the way the pain shot through her in waves that had nothing to do with growing pains, made Katie move through the rest of her shift with attention that had nothing to do with Dr. Pierce. Tuesday night came with the sound of a mother's panic before the ambulance doors even opened. Katie heard it in the waiting area, that particular pitch of a parent's voice when something is deeply, visibly wrong. Not the sharp panic of sudden trauma, but the ragged exhaustion of pain that had been building for hours, for days, a child's screaming that had worn smooth grooves into desperation. Emma Carver was 7 years old, small for her age, her left leg swollen to nearly twice the size of her right. She was screaming. Not the high-pitched shriek of a child with a scraped knee, but something deeper, the sound of a body in distress, muscles and tissues compressed past the point of normal pain. Her mother, dark-haired and hollow-eyed, gripped her daughter's hand so tightly her own knuckles had gone white. Katie was already moving before the charge nurse finished the handoff. She'd been at Seattle General for 8 months, long enough to recognize the rhythm of the department, long enough to know which doctors would listen and which ones wouldn't. She crossed to the pediatric bay where they'd laid Emma on the gurney, the overhead lights making the child's skin look translucent and fragile, and Katie's hands moved with the muscle memory that never left, that would never leave, hands that had once done far worse than take vital signs. "Hi, sweetheart," Katie said, her voice dropping to that careful register reserved for frightened children. "I'm Katie. I'm going to check on that leg, okay? It's going to feel cold." Emma nodded, tears streaming down her face, her breath coming in ragged, hiccuping gasps. Katie reached for the thermometer with one hand while assessing the affected limb with the other. Temperature 99.1. Pulse elevated at 118, tachycardic for a child that size. The leg itself was warm to the touch, the skin stretched tight and glossy, the swelling concentrated in the anterior compartment below the knee. Not diffuse swelling. Localized. Specific. How long has her leg been like this? Katie asked, not looking up from her assessment. 3 days, Emma's mother said, her voice breaking. The doctor said it was growing pains. He gave her ibuprofen and said it would pass. But it's gotten worse, and tonight she just started screaming, and I brought her in because I was scared, and they did x-rays and said her bones were fine and sent us home again, and then she got worse again so I came back and the woman's breath caught. Why isn't anyone doing anything? Katie's jaw tightened, just for a moment. 3 days. 5 different doctors, according to the chart she'd pulled up on the computer station. All of them had looked at a swollen leg in a child and walked away convinced they understood what they were seeing. All of them had missed it. Compartment syndrome. The condition where pressure inside a muscle compartment rises to dangerous levels, compressing blood vessels and nerves, cutting off circulation, killing tissue. In children it was rarer, which made it easier to overlook. The symptoms mimicked so many other things: growth pains, muscle strain, simple swelling. But Katie had seen it before. She'd treated it before, in field hospitals outside Ramadi where explosions and crush injuries created the perfect conditions for compartment syndrome to develop, where the window to save a limb was measured in hours, not days. "I need to get a pressure measurement," Katie said, keeping her voice level. "A compartment pressure test. It's quick, and it will tell us exactly what's happening in her leg." Emma's mother nodded, desperate for answers, for action, for someone to finally do something. Katie was already moving toward the equipment cart, her hands reaching for the needle and pressure monitoring device without conscious thought. She'd done this in tents with generator power failing and mortars landing 2 blocks away. She could certainly do it in a pediatric bay at Seattle General. That was when Dr. Pierce appeared in the doorway. He moved with the aggressive posture of a man who had decided something, who had already made calls and secured his position. Behind him came security, 2 large men in dark uniforms, their presence filling the small space like a storm system rolling in. "Step away from that patient," Pierce said. His voice carried the tone of a command, not a request. Katie didn't move. Her hands remained steady, the pressure monitor in one, the needle in the other. "She needs a compartment pressure measurement. Her presentation is consistent with—" "I'm aware of what you think," Pierce interrupted, his voice dropping lower, more dangerous. "I'm also aware that you have no medical degree. I'm also aware that you have spent the last 48 hours repeatedly exceeding your scope of practice, making assessments that are not your responsibility, and now you're about to contaminate the record on one of our pediatric patients. The room had gone very quiet. Emma's mother had stopped breathing. The child's screaming had reduced to small, frightened whimpers. Katie set the needle and pressure device on the cart with deliberate care. Her movements were slow, precise, the way a trained soldier sets down a weapon when the moment requires restraint instead of force. Her eyes met Pierce's for exactly 2 seconds, that flat, cold stare that had once preceded decisions in sandstorm darkness, and then she stepped back. "Security will escort you from the pediatric wing," Pierce said. "And I'm documenting this incident as another example of scope creep. One more step out of line, and I will have your nursing license pulled so fast your head will spin. Am I clear?" Katie didn't answer. She simply turned and walked past the 2 security officers, her badge clipped to her scrubs, her name and title visible to anyone who cared to read it. Neither of them moved to physically stop her, not yet, but they followed 3 steps behind as she exited through the double doors of pediatrics and into the main corridor. The fluorescent lights buzzed overhead with that particular hum of hospitals at night, a sound that existed just below conscious hearing but somehow permeated everything. Her boots made soft sounds on the tile floor as she walked, one foot in front of the other, moving away from the pediatric wing because that was what had been ordered, that was what the situation demanded. Behind her, Pierce's voice came out harsh and clipped, "And get security to document every movement she makes for the rest of her shift. I want a record." Katie didn't stop. She didn't look back. Her mind was already calculating, was already running through the timeline, was already doing the mathematics of tissue death and critical pressure thresholds and the difference between a child who would walk normally at age 12 and a child who would be fitted for a prosthetic instead. She made it to the break room, pushed through the door, and sat down at the small table where night shift nurses took their breaks between crises. The room smelled like stale coffee and the plastic of vending machine food. She pulled up her phone and looked at the clock, 11:13 p.m. Emma had been in the hospital system for 2 admissions now. The swelling had been ongoing for 3 days. The pressure inside that muscle compartment would be climbing exponentially now, each hour making tissue death more inevitable. A fellow nurse, Patterson, came in for coffee and saw her sitting there. "You okay?" Patterson asked, voice careful. "Fine," Katie said. "Just a break." Patterson hesitated, then filled her coffee mug and left. She would have heard, by now. The whole night shift would have heard. The nurse who'd been escorted out of pediatrics. The nurse who'd overstepped. The nurse who'd gotten herself on Dr. Pierce's bad side and lived to regret it, or at least, that was the narrative Pierce would make sure circulated. But that wasn't what Katie was thinking about. She was thinking about a 7-year-old girl whose mother had gripped her hand so tightly the circulation had probably suffered. She was thinking about tissue damage measured in hours. She was thinking about the difference between medical protocol and the emergency reality that existed in the space between what was supposed to happen and what actually saved lives. She was thinking about the fact that she had 48 minutes before Emma's pressure readings would reach irreversible levels. 48 minutes before the fasciotomy would stop being an elective procedure and start being an amputation prevention measure. The fluorescent light hummed. Rain began to fall outside, drumming against the hospital windows like coded messages. Katie sat very still, her hands folded in her lap, her face completely blank, and waited for the moment when staying silent became impossible. Somewhere in pediatrics, an alarm began to change its pattern. Not a code, not yet. But the kind of escalating distress that happened when vital signs started their final descent. Katie's eyes closed for just a moment. Then she stood up, pushed her chair back into place, and began walking, not back toward the pediatric wing, that was forbidden, that was documented, but toward the surgical wing instead, where the equipment was, where the supplies were, where a captain who had spent 12 years learning to save lives in impossible circumstances knew exactly where every instrument would be. The moment had arrived. Everything that came next would change everything. Katie returned to Seattle General at 6:24 a.m. for her shift, pushing through the main entrance with her badge already in hand, moving with the automatic efficiency of someone who'd done this 800 times before. The parking lot had been empty except for the overnight staff vehicles and rain that fell in sheets, the kind that made the asphalt shine like fresh blood under the sodium lights. She'd sat in her car for 19 minutes staring at nothing before coming in. The pediatric wing felt different. Quieter. Wrong. She knew before anyone told her. That's what 3 deployments to Ramadi teaches you, the silence before things break. Nurses clustered near the central station with their shoulders drawn up, eyes avoiding hers. One of them, Janet, who'd smiled at her exactly twice, suddenly became very interested in her computer screen when Katie walked past. The chart on Emma's door had a new sticky note. Restricted access. Dr. Pierce authorization only. Katie kept walking. The code blue alarm sounded at 7:08 a.m. like a scream in a language everyone understood. That particular combination of tones, 3 short, 1 long, meant pediatric trauma. Her hands moved before her brain caught up, years of training overriding the termination papers she'd signed 6 hours earlier. In the pediatric ICU, the monitors told the story in numbers that made her throat tighten. Emma's compartment pressure had climbed to 67 millimeters of mercury. Her blood pressure had crashed to 58/31. The toxins that had been building behind the fascial wall since the fluid started accumulating 3 days ago were flooding her bloodstream now, her kidneys shutting down, her heart working against pressure that shouldn't exist. The room was chaos organized by panic. A resident stood frozen with defibrillator paddles in his hands, looking at Dr. Pierce for permission to use them. Another resident was running a code blue checklist but 3 steps behind the patient's actual deterioration. 2 nurses were pushing epinephrine and fluid, but fluid was the problem. More fluid behind the fascial walls meant more pressure. Emma's mother stood in the corner, pressed against the wall like she could disappear into it, one hand over her mouth. Katie pushed past the nurse station, past the sticky note, straight into the room. Nobody tried to stop her. In emergencies, bodies moving with purpose are rarely questioned. Scalpel, she said. Not a question. Not a request. The surgical nurse's hands moved before her brain engaged, muscle memory stronger than protocol. The crash cart was positioned against the far wall. Katie pulled on sterile gloves one-handed while grabbing the 15-blade scalpel from the tray, her movements fluid as water finding a channel. The betadine swab was in her other hand before the thought formed. She swiped it across Emma's lower leg, a clean vertical line from knee to ankle, the orange antiseptic leaving a racing stripe down pale skin. The resident with the paddles finally moved. "What are you doing?" Pierce said. Katie made the first incision. The cut went through skin and subcutaneous tissue in one smooth motion, muscle memory taking over the way it had in a field hospital outside Fallujah when a Marine took shrapnel to the leg and the pressure was building and there was no time for hesitation. The moment the fascial membrane released, dark blood welled up, but not the gush of arterial hemorrhage. This was the relief of pressure, of compartment syndrome, slow strangulation finally breaking. 67 millimeters of mercury had been crushing the tissue behind the walls of her leg. In seconds, that pressure was dropping. The residents stared like they were watching someone perform magic instead of surgery. Katie worked through all 4 compartments, her hand steady as a surgical laser, each cut precise as someone who'd done this exact procedure 12 times before in combat conditions while mortars hit the building and blood dripped from the ceiling and the only light came from headlamps taped to her forehead. She decompressed the anterior compartment, the lateral compartment, the deep posterior compartment, the superficial posterior compartment, each one releasing pressure like opening a pressure valve on a hydraulic system. Emma's blood pressure began climbing. 62, 71, 84. The heart monitor found its rhythm again. Not the chaotic electricity of fibrillation, but the steady percussion of sinus rhythm. Katie closed with surgical precision, each suture placed with the kind of economy of motion that comes from doing something thousands of times. The incision sealed clean. Pressure readings, she said to no one in particular. The nurse who'd handed her the scalpel checked the monitor, her voice steadier now. Anterior at 32. Lateral at 28. Deep posterior at 19. All compartments decompressed. Katie finished the final knot and stepped back from the bed. Dr. Pierce arrived 30 seconds later. His face went from normal human coloring to something that resembled an eggplant with a medical degree. His mouth opened. Closed. Opened again, but no sound came out. He stared at the incision, at Emma stabilizing vitals, at Katie standing beside the bed with blood on her gloves and a look on her face that suggested she'd just taken out the trash. "What the hell do you think you're doing?" His voice cracked on the last word like he was 12 years old. She, security. Get her out of here." He grabbed his phone with one hand and Katie's arm with the other, his fingers digging in like he could physically erase what had just happened. She let him pull her from the room without resistance. Resistance would only delay things that were about to happen anyway. By 8:15 a.m., hospital security had confiscated her badge and informed her she was suspended pending investigation. By 8:19 a.m., the formal charges were printed on hospital letterhead: practicing medicine without a license, insubordination, criminal endangerment of a minor, violation of the healthcare fraud statute. By 9:03 a.m., Dr. Pierce was in the hospital administrator's office making phone calls that Katie could hear from the hallway. "I want her arrested. I want her prosecuted. I want her destroyed. No, I don't care what her employee record says. I don't care if she was deferential before today. She performed an authorized surgery. She could have killed that child. She could have. Yes, I understand the child survived, but that's not the point. The point is authority. The point is credentials. The point is that nobody overrides Dr. Pierce." Katie sat in the employee locker room for 45 minutes, staring at the folded flag in her locker. The flag made from the flight jacket of her best friend, who'd been 32 years old and had written his wife's name inside his helmet. The flag that wasn't supposed to be there. The flag that explained everything, if anyone had cared enough to ask. She pulled out her phone. Pentagon handler's number was still in her contacts under a name that didn't exist. The instructions had been clear: if your cover is ever compromised, make this call. We will extract you within 4 hours. Your new life is over. You will cease to exist. Her thumb hovered over the call button. But Emma was alive. Emma's leg would work. Emma would walk and dance and maybe become a nurse herself, and Katie would never know because in 4 hours she would be nobody again. Not dead, but not alive either. A ghost with a new name in a new city, starting over from absolute zero because she'd broken protocol to save a child's life. She didn't make the call. At 3:14 a.m., Katie sat alone in a diner 6 blocks from Seattle General, the kind of place with vinyl booths that cracked in 1987 and never got repaired, with coffee that tasted like the pot had been running since then. The mug in front of her had a skin forming on the surface. The rain had stopped an hour ago but was threatening to start again, the clouds moving like bruises across the pre-dawn sky. Her reflection in the dark window looked like a stranger. Tired. Older than she should be at 38. Someone who'd made a choice and couldn't unmake it. The waitress, name tag said Dottie, 55 years old, seen every kind of broken person sit in every kind of booth, asked if she wanted a refill without expecting an answer. Katie shook her head. On the table, her phone showed 17 missed calls from Seattle General Legal Department. 3 from the hospital administrator's office. 2 from a number she didn't recognize that had left a voicemail in a voice she did recognize: Admiral Brennan, someone from a life that wasn't supposed to exist anymore. She stared at the phone like it was a bomb, because in a way it was. Answering it meant people knowing. People knowing meant questions. Questions meant the Pentagon finding out she'd not only broken cover but actively used her credentials. Using classified credentials meant the classified operation was being declassified. Being declassified meant her handler was going to start making phone calls to people very far up the chain of command. Or maybe she was just sitting in a diner at 3 a.m. wondering if saving one child's leg was worth destroying the only life she had left. The phone rang. It wasn't the Admiral's number. It was the hospital. She didn't answer. It rang again immediately. Same number. This time she let it ring out, watching the screen light up like a heartbeat in the dark diner. The text came through while she was staring at it: Chief Petty Officer Carver is at Seattle General. Asking for you by name. Situation urgent. Katie's hands went very still. Petty Officer Marcus Carver was Emma's father. Chief Petty Officer Marcus Carver was also someone who'd been in Ramadi. Someone who would know a name she hadn't used in 4 years. She left a 20 on the table for coffee she didn't drink and walked back into the rain. At 3 in the morning, Katie sat alone in a diner called Mel's on the corner of Military Highway and 34th Street. The place was empty except for a waitress reading a paperback behind the counter and a man in a construction vest nursing black coffee at the far end. The vinyl seat was cracked. The table was cold. Her coffee had gone the color of rust and she wasn't drinking it. She stared at her reflection in the dark window, the fluorescent glow of the diner pressing against the night outside, creating a mirror that showed her nothing but a tired woman in blue scrubs with her hair still damp from the rain. That woman had hands that had held a child's leg open for 43 minutes while blood pressure climbed from 58/35 to 94/62. That woman had performed a surgical fasciotomy, cutting through muscle and fascia to release compartment pressure, with a scalpel from a code card and 2 frozen residents watching her work like she'd just pulled a gun from her waistband. That woman was going to lose everything. The hospital was going to suspend her. Federal charges for practicing medicine without a license. Permanent revocation of her nursing credentials. They would trace back through her employment history and find exactly what they were supposed to find: gaps, inconsistencies, a background check that didn't add up. After 5 years of being nobody, she'd just become somebody they could prosecute. She pressed her fingertips against the small scar on the back of her neck, the surgical mark left from a procedure she was never supposed to speak about, a consequence of a classified operation in 2019 that the Pentagon had decided should disappear from the record. They'd given her a new name. A new social security number. A nursing degree acquired through carefully constructed credentials that would hold up to a casual check but would crumble the moment anyone looked hard enough. She was supposed to be invisible. Silent. A ghost who helped people by day and existed nowhere at night. She'd just saved a child's leg by using skills that were supposed to be erased. The rain hammered against the windows like a drum that wouldn't stop. Katie stared at her reflection and asked the tired woman in the mirror a question that had no good answer: was it worth it? Was saving one child's leg worth destroying the only life she had left? The waitress refilled her coffee without asking. Katie didn't drink it. At 11 o'clock the next morning, Chief Petty Officer Marcus Carver walked into Pediatric Room 412 wearing desert fatigues that were still damp with humidity from his flight from Kandahar. His daughter Emma was sitting up in bed, her left leg elevated and wrapped, her face pale but conscious. She'd been unconscious for 4 hours after the fasciotomy. Now she was alive. She was going to keep her leg. She was going to run again. Marcus had flown 17 hours straight. He'd cleared emergency leave from his SEAL team, signed out of his forward operating base in Loga Province at 0400, and touched down in Norfolk at 10:47. A Marine liaison officer had driven him directly from the airfield. He was still carrying his weapons discharge paperwork. His boots still smelled like dust and diesel and things he didn't want to remember. He stepped into the room and his eyes found his daughter first, the relief of seeing her breathing on her own, alive, her vital signs normal. Then he looked at the nurse checking her full line. He stopped mid-stride. His face went the color of a man who'd just seen a ghost, and not the metaphorical kind. This was the kind of recognition that came from muscle memory older than words. This was the kind of look a warrior gets when something he thought was dead walks back into his line of sight. Katie turned slowly. She already knew who it was. She'd heard him coming from 40 feet away, the specific cadence of his boots, the way his breathing hitched slightly when he saw Emma, the sound of absolute command falling away into the vulnerability of a parent. She knew exactly who Chief Petty Officer Marcus Carver was. He knew exactly who she was. The color drained from his face like someone had pulled a plug. His jaw clenched. His right hand, the one with the scar tissue from an IED in 2017, flexed twice at his side. He stared at her for 3 seconds that felt like minutes. "Reaper," he whispered. The word hit Katie like a round chambered in the dark. That wasn't her name. That hadn't been her name for 5 years. That was the call sign of a Navy captain, a trauma surgeon who'd operated on 47 Marines under direct fire in the Jolan district of Fallujah, who'd held a field hospital together during the siege of Ramadi when 200 rounds per minute were coming through the windows. Reaper was someone who didn't exist anymore. A Marine liaison officer, a tall major with a chest full of combat ribbons, stepped forward and immediately pulled his phone from his pocket. He had the look of someone who'd been briefed on this scenario before getting on the plane. He scrolled through his notes and began reading, his voice steady and official in the middle of a pediatric hospital room. Captain Catherine Rodriguez, Navy Medical Corps. Attached to Task Force Fallujah, 2015 through 2019. Attended 47 combat surgeries under direct fire. Received Bronze Star, Silver Star, 2 Purple Hearts. Navy Cross for extraordinary heroism during 12-hour siege operations in Ramadi, October 2018, when she continued surgical operations despite active hostile fire, thereby saving the lives of. He paused. 43 Marines. The world had become very quiet. Dr. Pierce burst through the door in the middle of the major's words, his face already red, his pointing finger already extended. Excuse me, I need to know who authorized unauthorized personnel in my pediatric wing. This is a HIPAA violation. This is a security breach. This woman is under investigation for practicing medicine without proper credentials, and I will be calling security if she doesn't. A 2-star general stepped through the doorway behind him. The general was tall, his uniform fitted perfectly, his presence the kind that made the air pressure in a room measurably change. He was older, late 50s, with the eyes of someone who'd made decisions that got people killed and had spent 2 decades learning to live with it. He took one look at Katie. One look at the small surgical scar on the back of her neck. He didn't ask questions. He didn't speak. He raised his right hand and rendered a full military salute, fist to chest, arm extended, the kind of salute you give to someone of equal rank, given with the kind of respect that silences doctors. It was a salute to decorations Katie wasn't wearing. A salute to a rank she'd never claimed. A salute to a captain that everyone in this room now knew existed. Dr. Pierce's face cycled through the colors of someone realizing he'd just made a catastrophic mistake. His mouth opened. His attorney had appeared behind him. Katie recognized the look of court-appointed legal counsel from terminal cases. Pierce's voice came out as something between a whisper and a rattle. I didn't know. I was just following protocol. The general turned to him, and Pierce learned in that moment what it felt like to be observed by someone who'd commanded 4,000 soldiers in active combat. The general said nothing. He didn't need to. Pierce's attorney grabbed his elbow and began backing him toward the door. "We're not discussing this here," the attorney said, pulling him into the hallway. Pierce retreated to his office on the 3rd floor. He closed the door. He sat at his desk with trembling hands and reached for his phone. The first call was to the hospital board president. The second was to his personal attorney, not the hospital counsel, his own counsel. The third was to a consultant who specialized in reputation management. In 40 minutes, he'd outlined a strategy, control the narrative, get ahead of the story, establish himself as the victim of a larger conspiracy. Katie Rodriguez wasn't a decorated Navy captain. That was obviously a cover-up, a bureaucratic fiction designed to protect the hospital from liability. She was a nurse who'd falsified her credentials, and he'd caught her, and now the Pentagon was running interference to avoid scandal. By noon, Pierce was 3 paragraphs into a fabricated personnel complaint. He pulled Katie's employment file, the official one, the one with the gaps and the inconsistencies, and began creating documentation to prove she'd lied on her application. He forged emails from references that didn't exist. He doctored her initial background check to show red flags that had actually been edited out by federal handlers. He was building a narrative that would hold up to internal review, that would establish him as the conscientious department head who'd followed protocol, who'd protected patient safety, who'd been silenced by federal interference. He was 3 paragraphs into his second forged document when his computer screen froze. A Pentagon security flag appeared in red text across his monitor, unauthorized access detected. Federal investigation in progress. His office phone rang 15 seconds later. Dr. Jerome Pierce. A woman's voice, controlled and official. This is Special Agent Sarah Morrison with the Federal Bureau of Investigation. We need to speak with you regarding your credential verification procedures and insurance billing practices at Seattle General Hospital. You can speak with us now, or we can speak with you during your workplace arrest at 2 o'clock this afternoon. Your choice. 2 federal agents arrived at Seattle General at 1:15 p.m. with a warrant and for evidence boxes. They took his personnel files, his correspondence, his financial records. They asked about credential verification processes. They asked about 7 specific patients from the past 4 years whose charts showed billing irregularities that totaled $437,000. They asked about insurance scheme architecture. They asked about a pattern spanning 7 years of credential fraud masked by his departmental authority. By 3:51 p.m., Dr. Pierce was on administrative leave pending investigation. What the agents had discovered was this: in attempting to forge Katie's file, Pierce had triggered a Pentagon security protocol that unlocked an entire investigation that had been quietly building for months. His pattern was worse than anything he'd been trying to hide. 7 years. 7 different schemes. Multiple insurance companies defrauded. Credentials from medical schools that had never issued them. His entire career was constructed on fabrication and federal wire fraud. At 4:27 p.m., 2 federal agents walked Dr. Jerome Pierce out of Seattle General Hospital with his hands cuffed behind his back. They passed the vending machine where he'd mocked Katie Rodriguez. They passed the nursing station where staff suddenly became very interested in their computers. They passed the pediatric wing where Emma Carver was checking her leg mobility with her father watching. Katie watched from the cafeteria window as his car was sealed and processed. She didn't feel relief. She didn't feel vindication. She felt the specific exhaustion that comes from watching a man destroy himself through the simple act of trying to destroy you. 3 months later, Admiral Brennan sat across from Katie in a Pentagon office that smelled like old carpet and older authority. The office had no windows. The walls were soundproof. The deal on the table was explicit: full reinstatement of her rank as Captain Catherine Rodriguez, with all classification records unsealed and her Navy record officially restored. Or continued anonymity, with a new posting to a different hospital in a different city, her identity remaining classified, her skills remaining theoretical. Katie looked at the Admiral and asked a question that wasn't in his briefing papers. "Can I be both?" The Admiral leaned back. He was 73 years old and had commanded the Naval Special Warfare Development Group for 5 years. He understood what she was asking: to exist between worlds. To have her record restored but sealed. To be Captain Catherine Rodriguez on official documents that stayed locked in Pentagon files. To work as Katie Rodriguez, RN, MSN, in a hospital where she could use her surgical skills in emergency situations when the Navy quietly authorized it. To be a ghost who was no longer completely erased. "That's not how these agreements work," he said. "Then I choose the second option," Katie answered. The Admiral nodded slowly. He'd expected that answer from someone who'd spent 5 years learning to be invisible. "We'll arrange it." By the end of September, Katie was back at Seattle General, working the same pediatric wing, with a quiet approval from the Navy to use her surgical skills when crisis demanded it. Attending physicians who needed to know had been told just enough. Dr. Morrison had been promoted to interim department head. The 2 doctors who'd smirked at the vending machine were taking continuing education in humility. Emma Carver came for a follow-up appointment on a Thursday afternoon, walking without a limp, her gait completely normalized. Marcus Carver carried her backpack. When he saw Katie, he walked directly to her and shook her hand, holding it a moment longer than necessary. "Thank you, Reaper," he said quietly. Emma hugged Katie's waist. Through the hospital window, Katie could see the parking lot where Dr. Pierce was loading medical supply boxes into a van. That was his employment now, the only job his plea agreement allowed him. Federal charges reduced in exchange for testimony about insurance fraud schemes. His medical license was gone. His career was gone. His name was a synonym for shame in hospital hallways from Seattle to Norfolk. He looked up and saw her watching him. He quickly looked away. Back in the break room, Katie opened her locker. The folded flag was still there, the memorial to a fallen teammate from 2018, faded and carefully preserved. Beside it now, a photograph of Emma Carver smiling, her leg fully healed, her father's arm around her shoulders. Dr. Morrison approached the nurse's station, chart in hand. "Rodriguez, I need you for a consult. Post-op case, vitals are off and I want another set of eyes. You available?" "Yes, doctor," Katie said, her voice exactly what it had always been, quiet, competent, the voice of just another nurse doing her job. She followed him to the ICU, her footsteps silent on the linoleum, her hand steady, her presence unremarkable. In the break room, someone had taped a small printed card to the bulletin board, "True heroism is what you do when the world stops watching." The handwriting was anonymous. The message was clear. Katie saw it as she passed, allowed the smallest smile, and went back to work. If you found this story as powerful as I did, I need you to subscribe to this channel and hit that notification bell. Every video we make, we're telling the stories of people whose real strength was invisible until the moment it had to matter most. Comment below, have you ever been underestimated by someone who had no idea who they were standing next to? And share this video with someone who needs to know they're stronger than they've been allowed to believe.